hair transplant surgeon at HairMD Pune. Today we are doing this is third day of Dr. Shelkhil Sathe's hair transplant surgery, and we'll discuss few things about hair transplant surgery, how hair transplant surgery is done, and what are the important points, what are the important things during hair transplant. These things we will discuss. Now at present we are doing his punching and extraction process. In this case we are using 0.9 millimeter punch to extract graft from his temporal region. This is how this punch is used. It is having a motor with rotatory movement. Hair follicle has to be taken at the center of the punch, and then the punch drills around the hair follicle. The second person simultaneously extracts these grafts from the punch grafts. This has to be done very gently, very less pressure should be there, otherwise these grafts gets damaged. And during punching also you have to punch in the direction of the hair follicle, and otherwise if you are not in line of hair follicle, you can damage these hair follicles. Then these hair follicles, after extraction, they are kept into the chiller. There first they are examined under the digital microscope, whether these grafts are good grafts, whether there is any transaction, then whether there is deformity in the graft. If the graft is damaged, we discard those grafts, and these grafts are separated according to number of follicles: single hair follicle, 2 hair follicle, 3 hair follicle, 4 hair follicle, and they are separated into the chiller. Like this is single hair follicle chamber, 2 hair follicle chamber, 3 hair follicle chamber, and this count is recorded into a software which we have developed, and everything is mentioned in this tab, that is how many the transaction rate also for the follicles. Now this is how we have progressed in Dr. Sathe's hair transplant. We have designed his hairline. It is irregular hairline with micro and macro variations. We have planted single hair follicles in the front row, then the 2 and 3 hair follicles. Then this hairline we have designed according to his degree of baldness. He was having baldness in the frontal region and crown region, and mid scalp there was thinning. So we have given very good density in the frontal region, and in the mid scalp we have just filled his gaps, and on the crown region again the density increases. Then he was having temporal triangle recession. The temporal triangle has gone back, so we have designed his temporal triangle. You can see pre-made slits in the temporal triangle region. This part is very critical in hair transplant, because in temporal triangle region, hair direction and angle is very important. If you don't align your hairs in that direction, that can look awful after these hairs grow, and these hairs are very thin hairs, so you have to plant very thin hairs from the temporal region and lower neck in this temporal triangle. Again, the second part which is important is the crown. This is very critical during designing. Every person has a whorl in the crown region, so these hairs has to be planted in that direction, so that when they grow, they will form a whorl in the crown region. We have taken grafts from his occipital and temporal region. This is called as permanent zone, and we have taken grafts from his beard region also, and we have mixed these grafts very well, so that there won't be any differentiation between scalp hair and beard hair also. Now, Dr. Sade, how do you feel?
Yes, it was a 3-day session. Today is my third day. On first day we have transplanted around 1900 grafts in the frontal area. They have taken from the back side, back donor. Then second day we have taken grafts from the beard, and today is the third day. We are Dr. Sachin sir and the team is planning for the temporal triangles. They are planning, and some hairline they are going to make. So it was overall comfortable session. First day was very good. Local anesthesia, the effect of pain was as to normal. It was almost painless surgery. Today is the third day, and even today I am comfortable. Before starting the surgery, few blocks, RMD YouTube channel.
Very well. We have taken very surgery within 1 to 2 hours. So
Yes, thank you.
thank you.